From the Toronto Star, I'm Adrian Chung, and this matters. Every nation in the world has been trying to answer one big question. How do we control the spread of COVID? But to many people, we're asking the wrong question entirely. There is a belief among regular folks, some epidemiologists, and entire governments that we can quash COVID down to 0 cases, as in no community spread at all. The strategies to get this done can be complex, but the name for it is simple: COVIDZero. And some countries with pretty good records like Australia, Singapore, Taiwan, and most famously New Zealand have used COVIDZero as a matter of national policy in the pandemic. But all of those places, including New Zealand, are dropping COVIDZero for good. Here's Prime Minister Jacinda Ardern.
The return to zero is incredibly difficult, and our restrictions alone are not enough to achieve it quickly. In fact, for this outbreak, it's clear that long periods of heavy restrictions has not got us to 0 cases.
How has an online movement gained traction at the highest level of government only to be abandoned? Is COVIDZero even possible? And we'll talk about another big question we're all asking. What does it mean to learn to live with the virus? On This Matters, we're joined by our Toronto Star colleague and national reporter, Alex McKeen. Alex has been tracking and reporting on the COVIDZero movement. Alex, so great to have you back on the podcast. Thanks for making the time.
Yeah, thanks for having me.
So let's begin with the basics. What exactly is COVIDZero? Is it a strategy? Is it a movement? How would you define it?
It's both, but I would say when you're talking about COVIDZero, you're talking about the movement side of something that also has a strategy associated with it. So generally, the kinds of countries or jurisdictions, because it's not only countries, that are pursuing an approach to pandemic COVID-19 that is aimed at eliminating the virus altogether, those countries talk about it typically in those terms. We're trying to eliminate the virus. We're trying to get our cases down to 0, maybe they would say, but they don't necessarily use that terminology, that COVIDZero. COVIDZero is mostly a hashtag, and it's very much an online movement, something that has grown out of an appetite that people have, particularly among people who are outside of those jurisdictions pursuing an elimination strategy, that are looking at those countries kind of wistfully going, oh, why aren't we doing that? That seems pretty good. And so that's how they started talking about COVIDZero and hashtag COVIDZero. And you see people putting this phrase in their Twitter bios and tweeting out about it. It's sort of a way of signaling to one another that they're members of this online community. So it's a movement. It's a strange movement in the sense that it's almost entirely online. There's not COVIDZero protests happening in the streets. That would be pretty counter to what they're pushing for.
Right? Distancing, they believe in that, of course.
Yes, definitely. So yeah, I think COVIDZero is the movement side of it. Certainly it's centered on that elimination strategy that some jurisdictions, New Zealand, Atlantic Canada, have focused on and tried to accomplish in terms of dealing with COVID-19.
So if you ask somebody who supports the COVIDZero strategy, and you've talked to people within the movement, would they say the perfect scenario is a society where there's no COVID or that there's very few cases? Is it one or the other or completely 0 cases?
Yeah, great question. Something that is always a question that I have when I've spoken to people about COVIDZero is, what are the parameters for 0 COVID? Is it 0 COVID within the boundaries of a certain jurisdiction? Is it 0 COVID within a certain period of time? What is the real goal? And I think you get different answers from different people who promote COVIDZero. But the most common one, I think, is from what I've heard and the people that I've spoken to, is that they're advocating for 0 COVID cases, or at least 0 community cases of COVID. So maybe you have someone who flies in from somewhere else who then quarantines, and that's one COVID case, but it's kept in isolation and there's no community transmission of COVID within the boundaries of a certain jurisdiction. So using the Atlantic bubble as an example, there would be, during the time that Atlantic bubble was in place, no community transmission, but only within those boundaries. COVID is obviously spreading in the community in other areas outside of those geographic boundaries. And some of the people who are the most enthusiastic, let's say, about COVIDZero as a strategy would say, well, if only every jurisdiction in the world did this, then you could eliminate COVID altogether. But I think most people who promote COVIDZero understand that the more realistic thing is to do it within the boundaries of a particular jurisdiction.
Mm-hmm. So, we've heard a lot from, and we've seen a lot of coverage of the anti-vax, anti-mask movement, anti-everything crowd. It's safe to say that COVIDZero is on the opposite end of that spectrum of belief. That's fair to say.
Yeah, I think that's definitely fair to say. These are folks who really, truly believe that the best way to deal with COVID, and a lot of them will say the only way that you can deal with a pandemic like COVID-19, where you have a virus that is really that transmissible, is to lock down really hard, really fast, really completely, and to use methods like vaccination, but not to rely on vaccination maybe as much as we're doing in Canada, really promoting vaccines as the first and primary strategy and trying to ease off of other things like lockdowns. So yeah, I would say that's very safe to say that the COVIDZero crowd or movement is promoting something that is very opposite to what anti-vaxxers and anti-maskers are saying.
But you point out in your reporting, too, that even though, COVIDZero is very different to the anti-vax movement, they do, in some ways, in some corners, I should say, share some commonalities. Can you explain that?
Sure. There's one very clear commonality that they share, and that is that they have a very strong opposition to our public health officials here in Canada. I first became interested in the COVIDZero movement. Well, I've been watching Twitter this whole time throughout the pandemic and the way that conversations have evolved on Twitter. But it happened, I think it was in June that I first noticed this hashtag Fire Bonnie. And that was a reference to Dr. Bonnie Henry, who in British Columbia, she's our provincial health officer. And so I noticed that hashtag was trending and I thought, oh, here we go. We've got sort of an anti-vaccination crowd that is coming after our public health official for some reason. And when I explored it further, it actually was not the anti-vaccination crowd that was calling for that at all. It was the COVIDZero movement and members of the COVIDZero movement saying our health officials are failing us. They really squarely put this responsibility in the hands of our public health officials, saying that if we're not pursuing COVIDZero, we are putting our children at risk, people who cannot be vaccinated yet, right, if they're under 12 years old. We are putting people for whom the vaccines might not be as effective at risk, people who might not have as strong of an immune response. And they really emphasize those points, as well as people who might be susceptible to long COVID and things like that. So they have a very strong reaction sometimes to our public health officials. And that was when I first noticed it, was in June, when here in British Columbia, we were talking about our opening up strategy for the summer and relying on those vaccines, like I described earlier. And yeah, the reaction was pretty severe. And I was honestly kind of surprised by that. And I became interested in what the beliefs were behind that and explored it further.
We'll be right back. And for many people who believe in COVIDZero as a strategy, don't they often also point to rigorous research and science as being on their side? Again, there are epidemiologists, there are public health experts that support this idea as a matter of national policy.
Yeah, totally. I should have said that right away when we started talking about the comparisons between the COVIDZero movement and the anti-vaccine movement and anti-restrictions movement, because although there are similarities in terms of how much pressure they put on our public health officials, there are no similarities really at all in terms of how science-based they are. COVIDZero as a strategy, or at least this elimination strategy, has worked in some places. And there's certainly a debate that goes on between epidemiologists and doctors and all sorts of public health experts around the degree to which that could work here in various jurisdictions in Canada. But certainly there is good evidence that the jurisdictions that have followed a COVIDZero plan or a close to COVIDZero plan have done pretty well. And yeah, it's in some cases resulted not only in fewer COVID cases, fewer hospitalizations and deaths for those jurisdictions, but also to more economic freedom after those jurisdictions have been able to get down to zero.
Right. So one of those countries that you're talking about famously is New Zealand. They've done COVIDZero, whether they called it that or not, as a matter of policy through much of the pandemic. You look at their record, it is successful by any measure, right? Just over 4,500 cases total, fewer than 30 deaths. So why did they just abandon COVIDZero?
Yeah, I've got to tell you, I've got a fair bit of feedback from the COVIDZero folks in the last couple of days since New Zealand said that they're no longer going for zero. And the people who are promoters of the COVIDZero strategy here in Canada, they say that that's not really what New Zealand is saying, that they still are striving for elimination, but that they think it's less realistic now that Delta is spreading in Auckland. And what New Zealand has said, in August, they started to notice Delta, the Delta variant, which is much more transmissible, spreading around in their population. And they decided to go into a full hard lockdown. It's so hard and so full that, basically the only thing you can do is to go to the doctor, go pick up your medicines and go get groceries, like a very hard lockdown. So that was for the whole country at first. And then they moved it so that it was only in Auckland where Delta was still spreading. And after 7 weeks of that, they were still not able to get their COVID cases down to zero. And so what Prime Minister Jacinda Ardern said was, look, we cannot get down to zero anymore. And we're not going to necessarily keep this really harsh lockdown on forever in order to get down to zero. So she lifted some restrictions. They're still moving really slowly compared to other countries, compared to what Canada has done. It's basically, you can now meet some friends outside in a park where you weren't allowed to do that before. But they are saying that with Delta, it's just not possible to get down to zero anymore. So whether or not that's abandoning the elimination strategy, I'm not sure. I've heard arguments on both sides, and I don't know exactly what I think about that, but it certainly seems like something that was possible with wild type COVID is a lot less possible with Delta.
Right. And we have spoken to epidemiologists on this podcast who have said that COVID in some form as a virus, as a pathogen, will stick around for years to come. And so I guess it goes back to that question of, is it possible to get down to zero? If that is how somebody defines that strategy, is it possible on a disease level? It doesn't look super likely right now.
It's such a good question, especially at this stage in the pandemic when we're talking about having vaccines and trying to open up more. And those conversations about moving to an understanding of COVID as an endemic virus, as those conversations are starting to evolve, you have these jurisdictions, not only New Zealand, but also some countries in Asia, for example, South Korea and Taiwan, talking about, how can we open up our societies that have been fairly insulated and that have practiced certain COVID measures within our own borders. How do we open up to the rest of the world? Because unless the whole world is doing COVIDZero, it's not sustainable for any country to remain closed off to the rest of the world indefinitely. So what New Zealand is doing now had to happen eventually, probably.
I wonder what that means for the movement or for the people who have held up these nations as an example where COVIDZero strategies have worked. If those countries are no longer going after that strategy, is it even feasible? Does it even exist? We've also seen China, which is still doing a COVIDZero policy, but there are indications that in the new year they will scale that back. And so I wonder what people in the movement might think about all of this.
Yeah, they're really struggling with it. The people who I have spoken to, a lot of what they say about that now is sort of wistful, I think, in the sense that they say we had a missed opportunity here. We could have pursued COVIDZero back in March of 2020, and we would be in a much different situation now. But of course, we're dealing with our present context. We're not in March of 2020 anymore. And I think that a lot of people who are part of the COVIDZero movement say that in theory, there will be a time when COVID can be endemic and it can spread in the population without being a massive risk, And they'll cite things like when all children have access to the vaccines, that could be a time when things really change, or when there's just fewer cases overall in the rest of the world. There's sort of a future time that COVIDZero proponents talk about when there could be an endpoint to needing the COVIDZero strategy, but it's unclear to me exactly when it could feel right to them to move forward on something that is not a COVIDZero strategy. It really seems like the tolerance within this group of people, or what they've been promoting all along, is that there should be no tolerance for community transmission of COVID. So there's a big switch to happen for them that I think they're dealing with right now in how to think about COVID, how to view the risks associated with COVID. And it's scary for them, as I think it's scary for lots of people.
Yeah, it seems to be almost a proxy for maybe the questions so many of us are asking and governments are asking of these two, maybe in some ways a contrasting idea of, we have to shut things back down until we have COVID under control. And the other idea of we have to learn to live with the virus. We've heard that too. It seems like they're asking themselves the same questions that many of us are asking of when is the right time.
When is the right time? Yeah, that's right. And basically what you've heard from the COVIDZero movement up until now is it's not the right time yet. So we'll see how that evolves and if it evolves. I'm really not sure where it's going to go. I will say that the people who I've spoken to who are members of the COVIDZero movement, a lot of them have really, personal reasons to be invested in this, some personal experiences with illnesses in the past, having gotten a virus and having long-term effects from it. Or a lot of them are parents too, and they're worried about their kids getting sick with COVID. And I think those kinds of concerns are really valid and drive a lot of the feeling here.
Alex, thank you so much for your reporting. It's always great to talk to you.
Yeah, great to talk to you too, Adrian. Thanks so much.
And that is Toronto Star reporter Alex McKeen. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachnick, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis, and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.